Hello, my name is Representative David Bly. I just wanted to talk with you a few minutes about something that I've been hearing about as we've finished our session and are out talking with constituents about the work that we did. The issue that I want to talk about is the General Assistance Medical Care, which is a policy established some years ago to provide access to health care for really the sickest and the poorest of our Minnesotans. And also to make sure that hospitals and health providers that serve those patients, those clients, are able to get reimbursed for the good work that they do with them. In visiting with some of the folks who receive these benefits or this ability to get healthcare access, these are folks that without medications, without the treatment that they need, that's an ongoing concern, will fall into more dire straits if they don't get that help. A place that none of us would want to be if we found ourselves in those circumstances. So it's an important policy that we need to make sure in some way we help them with. This past session was a difficult session. We had to cut back on funding, and the governor's proposal was that we eliminate this policy, which bothered a good deal of members who had constituents who really relied on this this policy in a very important way. So I know when I go out and I talk with my constituents in Lonsdale and other communities who have been receiving GAMC, they tell me that the changes that we've made, and we had to make some changes in order to work with the governor and find a way to keep the policy in place, but not but reduce some of the cost. We had to reduce costs across the budget, and this was one area where the governor really wanted to see some changes, and we managed to work with him. But the solutions that we came up with have caused an unusual problem. The folks in Lonsdale, for instance, tell me that when they go to their clinic now, which is a rural clinic attached to the Northfield Hospital in some way, they can no longer get service there. They're told by the folks there that they need to go to the cities. Unfortunately, a number of these people don't have transportation. They're going to have to rely on friends or relatives that they may know who might be able to help them get to a clinic in the cities. If their health needs weren't that important or desperate, maybe it wouldn't matter that much. But these are people that need ongoing care, and it's a real hardship for them to get those necessary health benefits met. So this is something we're definitely going to have to revisit in the coming session, something we're going to have to deal with in the future. I hate to think of leaving those folks who rely on that kind of care to have to go to great lengths to get that care met. I also think it's important that we can't just ask hospitals or health providers to provide that care either through an emergency room or someplace else without good reimbursement for the care that they provide, because that only spreads the cost onto the rest of us and taxes their ability to provide the care they need for everyone else. So this is an issue that's important, and I appreciate your time in listening to me talk with you about it. Thank you.